I started out as a medical scientist in the microbiology lab, much like this one. So part of my role involves coordinating the Curtin Laboratory Medicine students throughout their practical placements at the different pathway sites. Aaron Lee, he's a student from Curtin completing the Bachelor of Science Laboratory Medicine degree, and he's now completing 7 weeks in the microbiology lab. There's a lot of different sections within medical science. The students complete 7 weeks in each of their different majors, which could be in microbiology, haematology, biochemistry, histopathology, cytology, immunology, and then even within those disciplines we have a lot of smaller subsections and molecular and genomics, and there's a broad range of different areas that you could specialise in as a medical scientist.
So if there's anything complex that we need to investigate, we can do a manual procedure or a manual technique, and this basically involves just your serology. We've got these cards which are designed for basically doing your forward and reverse group.
My name's Noelle Chow and I work for PathWest at Royal Perth Hospital. I started off with a Bachelor of Science in Medical Science at Curtin University, and then I did an extra year of postgraduate honours. I then came out and worked as a casual scientist at Fremantle Hospital in the histopathology department, and then eventually I started my work in blood bank or transfusion medicine, and I work in special immunohaematology.
So this is now ready for incubation. We're going to put it in the incubator. This incubation period is for 15 minutes. It heats it up to 37 degrees, and that's your normal body temperature. So after that, what happens is we spin it down, and then basically the reagents will tell us whether or not the patient's got an antibody.
What you learn in university is your theories, and then we obviously learn technical skills as well. But when you come to the job, you're applying your theory and knowledge to your everyday work processes and workflows. Say, for example, malaria, you learn about how obviously malaria is transmitted, and then in the lab training you get to look at a various number of films and help diagnose that. But when you come out into the workplace, you're actually applying your knowledge and your theory in real life. So when a patient comes in through ED and is quite unwell and they do a blood film and they suspect malaria, it is then up to you to look through the film and look down the microscope and see if you can detect any parasites. A lot of our methods that we use now, our analyzers, is being shrunk down to smaller levels, especially with the use of molecular technology. You know, you can scan someone's blood and detect genes which may encode for certain, diseases or malignancies. It certainly makes our lives easier in terms of performing the tests and making a more efficient service, and that's what you want for patients.
What we're doing is an ABO blood group, so effectively what we're doing is trying to find out what blood group they are, whether they're APOS, OPOS, A neg, B neg. So we do a forward group, so that detects what antigens are on the red cells, and we also do a reverse cell as well to make sure that forward and reverse group match up. It's very vital that we always identify the patient correctly and get the blood group correct. Now they're probably going to be positive, so you're better off running everything at the same time.
I supervise the students when they come through. I develop the program in terms of making sure that they get a broad range rotation through all the different areas of haematology. We generally supervise them for their duration of their placement so that they can do things which obviously allow them to develop their skills and apply their knowledge and theory that they've learnt at university. The future looks really great in terms of medical science. There's lots of new up-and-coming projects and research ideas coming through. So I'd really like to expand my knowledge and input into the area of haematology, malignancy. So in terms of helping transplant patients, bone marrow transplant and stem cell transplant patients effectively achieve a good recovery in terms of after their therapy and after their treatment. Research has come a lot of way. There's lots of new molecular techniques, and I'm hoping to apply or maybe develop new molecular techniques to help us make a more efficient and precise measurement of disease and diagnosing clinical patients.